Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Personality test. So first we look at the MMPI2. So what is MMPI? So MMPI stands for the Minnesota. So Minnesota is what you need to remember. So Minnesota Multiphasic Personality Inventory. Multiphasic Personality Inventory. So here, what are the uses and its characteristic? So uses of this Minnesota test is, so let me repeat the full form. It is Minnesota Multiphasic Personality Inventory. So let's look at uses. So what does the use signify? So the most common use is objective personality test. So there is an objective personality test which is done. Next is, it is useful for the primary care physicians. So it is also present in primary care physicians. And this is because there is no training is required for the administration as well as scoring. This primary care of physicians, and there is no requirement. So there is no requirement of the administration as well as for the scoring. Next is to evaluate. Next is to evaluate the attitude. Evaluating of the attitude of the patients towards the taking the test. So evaluate the attitude of patients towards taking the test, or the patients towards taking the test. Now let's look at the characteristics. So in terms of characteristics, it includes, it is an objective test, and the patient answers 567 true or false questions. So you have to answer 567 true or false, T or F questions. Next is, there's a clinical scales include the depression, paranoia. So clinical scale. So this clinical scale, it includes the depression. So it includes depressions, there is paranoia, as well as there's schizophrenia. There's paranoia, there's schizophrenia, and the hypochondrias. Next is the validity scales. The validity scales, it identify and try to look ill. So validity scale, so there is something known as a validity scale. So validity scale is identifying and trying to look ill. So trying to look ill means it's faking the bad or the malingering. So you fake your health or malingering. It's famously known as malingering, or trying to look well, or faking good, or try to look good, or it is faking. Next we move on to the Rorschach test. Rorschach test. So the spelling will be RORSCHACH. So Rorschach test. So Rorschach test, the uses, it is the most commonly used projective personality test. So it is a projective. It is a projective personality test. It is a projective personality test, and it is used to identify the thought disorders and the defense mechanisms. So it is used to identify the thought disorders. So it is for the thought disorders as well as the defense mechanisms. Now let's look at some characteristics. So here characteristic, it is nothing but a projective test. Another thing is, the patients are asked. So the patients are asked to interpret 10 bilateral asymmetric ink blot designs. So 10 ink blot designs you are supposed to interpret. So you can describe what you see in this figure, like that. Whatever you can see, you are supposed to be describing it. Next is, we look at the TAT. So what is TAT? TAT stands for the thermic apperception test. So it is a thermic apperception test. So thermic apperception test, it uses the stories are used to evaluate the unconscious emotions and the conflictions. So the stories are used to evaluate. So stories are used, and it evaluates the emotions as well as the conflicts. So the emotion is used as well as the conflicts. They are used. So what are the characteristics of this? Characteristic is, it is a projective test. It's a projective test, and the patients, they are asked to create a verbal scenario. So you are made to do a verbal scenario. So there is a verbal scenario which has to be done, and they create a verbal scenario based on the 20 drawings depicting the ambiguous situation. And you have 20 drawings. So there is 20 drawings and they depict the ambiguous situation. So it depicts the ambiguous situation. That is example using taking a picture, making up a story that it has been the beginning, middle and the end. So that's what you do. So use a picture, you make up a story telling the beginning or the middle and the end. So other thing to notice, the sentence completion test. This is the next test we are going to look. This is the sentence completion test. So the sentence completion test, it uses to identify the worries and the problems using the verbal associations. So you see the worry. So you look at the worry or the problems. So you look for the worry or the problems, and this is using a verbal associations. This is using verbal associations. Verbal associations. So then comes the presence of characteristics. So what is present in characteristics? So in characteristics of the sentence completion test, it is nothing but a projective test. So this is a projective test and the patients complete sentences started by the examiner. So the patients, if you see, they complete the sentences. So they are able to complete sentences and started by the examiner. So started by the examiner. To learn and grow daily like this, please do subscribe.